Good day. My name is Karim Chichakly. I'm from IC Systems and from Worcester Polytechnic Institute. I want to talk about modeling some COVID-19 policies that were in Brazil and in the United States, two different cases. The first case is going to look at the effectiveness of vertical shutdown, vertical isolation, which was the type of shutdown that was proposed in Brazil. And then we're going to look at the economic impacts of shutdowns. Vertical isolation is the idea that we isolate some people who we think are more vulnerable and we don't isolate other people, versus horizontal isolation where everyone gets quarantined, for example. At IC Systems, we did a bunch of SEIR modeling when the pandemic started. We had 3 or 4 different models, maybe more, but we had a bunch of models we were playing around, and we noticed a few things. First of all, the standard SEIR model leads to a much lower average residence time than we expect. So we say we want the average residence time to be 5, but the problem is it isn't 5 because the largest fraction leaves a stock in an SEIR model, standard SEIR model, at the very beginning, immediately. And that's because it's a first order material delay. We also noticed that there was a strong correlation between age and symptoms, severity, behavior, yet most models disaggregate by severity but aggregate symptom presentation, severity, they aggregate behavior. They don't separate them out. So the idea of this first model we're looking at is that if you disaggregate by age, you can catch some new dynamics. In particular, you can check things like vertical isolation, which is a policy that's age specific. Let's just look at material delays for a minute and see what happens. If I have this pulse input to a material delay, I show the first order response, which is again the first order material delay is what is used in an SEIR model. Okay, so we see that the largest fraction leaves at the very beginning. A third order is a little later. Some leaves clear near the beginning. Remember, here we have a delay length of 5. So this, ideally, your center point's going to be here. So 6th order and 9th order get a lot closer to here. The 3rd order is a little behind, but you know, it really depends how they're distributed around this. Again, a first order material delay, this is what it looks like. It's a a draining process. And this is the E and I part of an SEIR model. We have a stock of exposed, so they're carrying it, but they don't have symptoms, and infected, they have it, and they are showing symptoms. And to get there, we have a flow that's just exposed divided by the time to show symptoms. That's the flow. A third order takes this stock and flow and expands it into 3. The order is just the number of stocks we have in the delay. So here we have 3 stocks. And the time for each one is just this divided by 3 because it's third order. Now, if we want some arbitrary order stock, there's a trick that we can do without having to show all that mess, all those extra stocks in the middle. John Sturman suggests this in his book in the cases where we need an nth order delay, and we need to know the stock value, the underlying stock value, because if we don't express it by a number of stocks, we don't know the stock value because the built-ins don't tell us. And that is to connect the inflow to the outflow and derive the outflow from a built-in function like delay 3. So the outflow of exposed is no longer based on what's in exposed, it's based on the inflow, and we're doing a material delay, third order, delay 3, or 6th order here. And this works fine because this function has all those stocks underneath. So we still have a bunch of stocks connecting these. We just don't see them. Unfortunately, the simple trick doesn't work if you have multiple outflows from a stock, for example, for testing. I have a blog entry here that talks about how to do that. And I can show you this model that I used. This is a macro that I used that created a multi-stage delay with multiple outflows to make this work. And that's what I used in the model, by the way, that we're going to look at. So the standard SEIR model we have a stock of susceptible, exposed, infected, and recovered. Exposed is, they have it, but they don't have any symptoms. They may or may not be contagious. For COVID-19, they are contagious. So we have this trick that we're using here for becoming infected. So we're using an nth order delay here. And then we do the same thing to become from being infected to recovering. We're also using a distribution and nth order delay here based on the time to recover. So we're using the same trick for both of those. And you should remember, if these are contagious, then the sum of those are the people who can make these people sick. So probability that they will contact someone who's susceptible times the number of contacts there can be are the contacts of these people with these people, and that's how many will become exposed. Well, there's an infection rate too. It's not 100%. It's much, much, much lower, right? Just because I run into someone who's sick doesn't mean I'll get sick. Okay. If I add testing, though, it becomes more complicated. Now I have people who are exposed but no symptoms, but I've tested them and they're positive. We're going to quarantine them, and then they're eventually going to become infected also while they're quarantined. People who are showing symptoms, I'm going to want to quarantine. And then those people are going to recover, as are the infected people originally. So it's a bit more complicated with testing. And I need that other structure that I just showed. Now, if I want to disaggregate it by age, it becomes even more complicated. Okay, so I may have some time in here where they're exposed but not really showing symptoms. By age, they may have mild or no symptoms and be in here, right? And then we're not going to quarantine them because we don't know they're sick. So that can make a difference. But everything here is disaggregated by age. Everything's a rate at this point. And you'll notice, so it's a much, much bigger model. And you'll notice there are also deaths from those who are infected and quarantined, assuming that if they had symptoms enough to be quarantined, there's a severity in there. There are some people who are severe enough that they will die. The contact fractions are determined from the population based on ages, and we have here contact fractions by age in China. I actually came up with my own set of numbers that ended up matching this almost exactly. It's kind of freaky. But this data is readily available. And then there's a symptomatic fraction, those who have symptoms by age. And that is on the next page, the data for that. And then we also have death rates by age. That also, all those numbers came from China. So these are the contact fractions I used. The ages, those who are 0 to 9, with people who are 0 to 9 and et cetera all the way up. You'll notice that I used 10 to 15 instead of 10 to 19 and then 16 to 29. I put these in the same group because these people operate somewhat independently, whereas these are still somewhat under parental control. So their behavior is different. So even though everything here is a decade, these I did not do that way to capture that dynamic. Symptomatic fractions are here. You'll notice it's higher as you get older. Death fractions as well get higher as you get older, even though I'm not showing those here. I didn't divide also into mild, severe, and critical. You could do that, but I didn't. And you could also calculate what it should be by using aggregate fractions, right? You don't necessarily need to divide it in the model. You can find the model on the IC Exchange in the IC sample models, by the way. This is the full path, but let's go play with that model briefly somewhere over here. Oh, that's the PowerPoint, sorry. There it is. Okay, so here we have the only policy choices we have are horizontal isolation, vertical isolation, and vertical isolation with closed schools. If I run this model in the base case, which is here, which is horizontal isolation, we've quarantined everybody. We have this kind of pattern. We have about 1,000 deaths. This is out of 1 million. We have by age group, the older people are dying more, but we can see that more easily here. We can see there were not that many people who actually got sick. This is how many people recovered. So the total number of people who got sick are here because that's how many recovered. And we can see the top of the scale is 453 and 1,000 here. But 453, remember that. Remember this. 50 is way down, age 50, age 40, really low. And let's turn on vertical isolation. So in vertical isolation, we're just isolating the elderly, no one else. Notice there's a dramatic change. First of all, a lot more people get sick and a lot more people recover. A lot more people die, 7 times the number of people die. You'll notice the distribution here. This was 473 or something, 400 something. It's now 2.5K. So a lot more older people died, but notice a lot more people who were younger died as well. This was way down here. This was like way down here. These are all, people died at all ages. So this really doesn't work. And then if we add in, we can then also close the schools. There's been a lot of research that shows that children in schools are vectors for bringing disease back to their families and spreading it through communities. And by closing schools or by vaccinating children, we can reduce the spread of disease through a community. If we do that, we can see things are much better again. They're not as good as they were, but they're still pretty good. You'll notice that the age 50 group is still hit harder than it was before, and there are plenty of reasons for that, which we won't actually go into in this right now. This is with a city size of 1 million. If we have a larger city size, things get much worse. These are our parameters that we can set, by the way, the length of the quarantine and the effectiveness of the quarantine by age, and then the size of the city. You'll notice if we start again, and let's reset everything. So for a large city, there's not a big deal, but vertical isolation, we all of a sudden have tremendous number of deaths, 200,000 deaths. Why? Because there are more people who can become infected. There are more people who are going to die, period. Okay, enough on that. That's depressing enough, don't you think? So conclusions. Vertical isolation as a strategy, which, by the way, Bolsonaro was calling for that in Brazil, but the U.S. people were calling for this also in April. Open up everything and just keep the elderly and sick at home. The conclusion is vertical isolation does cost lives, and that's in all age groups, not just in the elderly. The effects are much larger in larger communities. If you turn on vertical isolation, we had a lot more, hundreds of thousands of deaths. And in Latin America and other countries where multiple generations, or cities even in the U.S., where multiple generations live in the same house, the impacts of vertical isolation are much worse because everyone's mixing with everyone, whether or not they stay at home or not. Vertical isolation with closed schools can work in some cases, but again, if you have multi-generational homes, there is still a problem. Okay? So that's my vertical isolation. Interesting things. Let's look at economic impacts of coronavirus, and we'll turn back to the United States for that. Although I did talk about the United States at the end there, about how some people were calling for vertical isolation in April. Earlier this year, we had shutdowns across the world. There were lots of them. Stay-at-home orders, don't go out, close your businesses, etc. We're likely to see more of these before this is over. Hopefully, they're all going to be local or regional. We've already seen some, by the way. And they have been localized. They haven't been everybody. But these shutdowns can have large economic impacts because businesses can collapse because they're closed. They can't keep paying their bills. They can't stay in business. And people are then not employed. And so they lose their ability to make money to survive, pay their rent for their homes, their mortgages, whatever, for food. That's pretty important. Health bills, health insurance in the United States. And we have this vicious cycle, this downward spiral that gets created as income becomes lower. The the ability to spend becomes less, and the economy gets hurt by that because the economy depends on people spending money. So the question is, can government policies mitigate some of these impacts? In the United States, they passed the CARES Act in late March. What it gave were loans that can be forgiven. These were given to small businesses, and if you don't cut payroll, they can be completely forgiven. You don't have to pay them back ever, so they become gifts. And this was called the Payroll Protection Program, and it was designed to keep people employed and to keep businesses running. They could spend some of that money for their business, for rent and things like that. They also extended the unemployment benefits for 3 additional months, which in most places made it for 6 months total. And because it was 3 months, it's 3 months in most states. This is similar to what Obama did in 2009 when he extended unemployment benefits for a year. They added a $600 per week. No checking on what anyone was making before. $600 per week unemployment bonus through July 31st. So everyone on unemployment got $600 extra per week, which is $30,000 a year, by the way. It's actually, if we want to get serious, it's $31,200 a year. Quite a bit of money. And I will refer to this as the unemployment stimulus. I'll try to remember to do that because there are the PPP, this is the Payroll Protection Program, is also a stimulus. And there's also this $1,200 stimulus payment one time that was given to everyone making less than $75,000 a year. If you made more up to $99,000, you got a little less until it was zero at $99,000. In any case, it also included $500 per child. And there was also, and I didn't model that, by the way, because it's just a one-time, I'm not sure that had a big impact. There's also a 6-month eviction moratorium for people who are renting and a mortgage payment moratorium where you could rewrite your mortgage and just pay interest for the 6 months and then go back to paying your mortgage after that. So those, I didn't model that either. So those are the things that were added, that were now available. Now I modeled this by looking at the number of businesses, people who are in business, whether or not they're open or not. And the more businesses there are, the more businesses will be open. The more businesses that are open, the more likely there will be more businesses that open. But the important thing is when the stay-at-home order happens, the number of businesses open goes down. And after a delay, the number of businesses that still are around goes down also. The more businesses that are open, the more jobs there are, the more income there are from jobs, and therefore there's more spending. This is the loop I was talking about on the previous slide. And the more spending there is, the more jobs there can be. The more businesses are open, the more spending there is by businesses also. The more jobs there are, the less unemployment. But let's look at it the other way. The fewer jobs there are, the more unemployment. The more unemployment, the higher the unemployment benefits. The benefits give them money to spend, which helps. The more spending there is, the more businesses survive. And that creates a reinforcing loop here and a balancing loop all the way out here, all through here. There's also another reinforcing loop through here. And the higher the unemployment, the more likely people will save. The savings rate will go up, so spending will go down. And in fact, this is what happened. The marginal propensity to save in the United States went up to 13%. It was about 6 or 7. And this is not only by people who are employed, but you're giving people $1,200 stimulus check, and you're giving them an unemployment stimulus, the ones who aren't working, $600. For a lot of them, it was more than they were making. They could save some of that away too, and maybe they did for a rainy day, right? I don't know how many did or didn't, but they could. And the savings rate went up quite a bit. So that slows things down again. The unemployment stimulus here helps increase the unemployment benefits. That's the $600 per week, and also the larger length of time. And the stimulus also went to businesses to help them stay around a lot longer. The model here is also in the IC System sample models on the IC Exchange. Here's the link to it. And let's go play with that model. Hopefully we can find that one. Here we go. So this model, let's just run it. And this is assuming a shutdown for 2.5 months with a gradual return to normal after that. It starts here, and we have an unemployment rate that goes up. We have the number of businesses falling, the total business revenue falling. So you can see the effects on the economy, and the unemployment rate is quite high. Now, let us play with the unemployment benefits. If we extend the length of unemployment benefits, after turning this on, after turning on the stimulus, if we change the length of the unemployment stimulus, you can see it's impacting first of all, the unemployment rate's going down, number of businesses surviving is higher, and you can also see that as this gets longer, there's more revenue out here. You can see that change. Let's reset that. And of course, if we change the amount of money they get, if there's less money, there's less business revenue, right? And there are fewer businesses. If we increase it, it does help up to a point. It doesn't make a big difference much beyond where it was. The real thing to look at, though, is the payroll protection program, PPP. If we increase this, if we just even introduce this, we can see it has a huge impact. The unemployment rate falls because we're keeping all those people employed now. The number of business that survives goes up, the revenue goes up, so there's still some impact in the long term to the economy, but this is making a big difference. This is actually a really good program. You can see if they make it even longer, instead of 8 weeks, it was 8 weeks. It actually has, a really good impact on things. There are some parameters. No, there are no parameters, sorry. Okay. Conclusions from this model. So stay-at-home orders have effects of making businesses fail in the short run, and in the long term, where long could be 2 to 3 months. Well, let's talk longer because unemployment benefits run out after that. But people suffer and the economy contracts. We saw that in the model. The CARES Act policies that helped mitigate these effects were investing in the small businesses. The payroll protection program was really good, kept people employed. We could see that in the model. Extending unemployment allowed people to survive. The unemployment stimulus helped boost the economy in the short run because people had the money to be able to spend so that we didn't have businesses failing. So that also helped businesses stay around. That $1,200 thing did a short little burst, but I'm not convinced that did much of anything. Consider the fact that two weeks of the unemployment bonus or stimulus was $1,200. There were some unintended consequences, though, of the CARES Act. 2/3 of the unemployed people were making more money on unemployment than they were working. So they didn't want to return to work until those benefits expired at the end of July. And some people actually left their jobs voluntarily to try to collect that extra money because they could make more money. I didn't model this either, but I didn't model rent, but the whole mitigation, the whole moratorium on evictions from rentals, great. So you don't pay your rent for 3 months. What happens when all of a sudden you can be evicted after that time, or 6 months? You can't ever catch up. You're 6 months behind on your rent. You haven't been able to pay it. You can't pay it now. And by the way, you were probably just barely squeezing by before. How are you going to possibly make up for that? You're going to get evicted. And in fact, that is what happened. A bunch of people got evicted as soon as that ran out. In a few moments, we'll take questions if you have any. Thanks for listening. Talk to you next time. Bye.